guys, welcome back. This is the seventh part of our RRB MCQ series. So, in this, we are going to further discuss some important questions that are relevant for RRB examination, dialysis examination. So, let's begin. So, the first question here is uh, which monitoring parameter on a hemodialysis machine is most critical to assess and prevent hemolysis during dialysis? So we have to choose one particular monitoring parameter and which is critical to prevent hemolysis during dialysis. The first option is transmembrane pressure. The second is dialysis temperature. The third option is ultrafiltration rate, and the fourth option is blood flow rate. So the right answer will be dialysis temperature. If the dialysis temperature will be within its range, we can prevent hemolysis during dialysis. So if dialysis temperature becomes too high, it can damage red blood cells and cause hemolysis. Modern dialysis machines closely monitor dialysis temperature for this reason. While blood flow and pressure matters, overheating is a major direct cause of hemolysis during dialysis. Moving ahead to the second question, it says which type of vascular access has highest risk of infection? So we have four options here, and we have to choose the one that has highest risk of infection. So we have four vascular access. The first one is non-tunneled catheter, second one is AV graft, third one is AV fistula, and fourth one is tunneled catheter. So it is very easy question. The answer will be non-tunneled catheter. Non-tunneled central venous catheter has highest infection risk because they directly enter the central vein and lack protective scuff. So the major difference between a non-tunneled and tunnel cuff catheter is they have the tunnel catheters have a cuff that attaches and they are embedded in the skin, so they are not directly in contact. So that's why they are less vulnerable compared to non-tunnel catheters. So non-tunnel catheter will be the answer and are on highest risk of infection. Moving ahead to the third question. Third question is which of the following is not a type of synthetic dialyzer membrane? So here we have four options and we have to choose the one which is not a synthetic. So first option is cellulosic, second is polyacrylonitrile, third is polysulfone, and fourth is polyether sulfone. So these all are synthetic, but cellulose is not synthetic, it is natural. So this is odd one out. So cellulose membranes are derived from cellulose and are considered semi-synthetic or natural. Polysulfone, polyacrylonitrile, and polyether sulfones are fully synthetic membranes used in modern high-flux dialyzers. Moving ahead to the fourth question. So fourth question says, what is the preferred anticoagulant approach in CRRT for a patient with thrombocytopenia? Now the patient is vulnerable and has a case history of thrombocytopenia. So we have to choose an anticoagulation approach particularly. So the first option is citrate anticoagulant. Second one is anticoagulation free dialysis. No. The third one is normal heparin anticoagulation. It would have been the answer, but since it has thrombocytopenia, so this one is wrong. Low dose heparin anticoagulation is also wrong. Whenever they will tell you about thrombocytopenia, the answer will be citrate anticoagulation. Though in CRRT, the most common anticoagulant that we are going to use will be unfractionated heparin, but when the case will be thrombocytopenia, it will be citrate. Why citrate is not most common? Because we cannot easily monitor it, and it is hard to monitor. Not easy, it is hard to monitor its level. So that's why. Moving ahead. So moving ahead to the fifth question here. It says heparin free dialysis is commonly used in. So we have to tell where we use heparin-free dialysis. So option 1 is patient on anticoagulation therapy. Option B is outpatient on outpatient dialysis. Option C is patients with high clotting tendency. And option D is patient with recent surgeries or active bleeding. So if the patient is having high clotting tendency, so in that case we have to definitely use heparin. So this is wrong. Outpatient dialysis, they generally are given standard heparin dose, so it is also wrong. Patients on anticoagulation therapy, so this does not make any sense actually. So the patients with recent surgery or active bleeding, now in these two scenarios, what will happen if we give them heparin? If we will give them heparin, then there are higher chances that they will start active bleeding. So that's why they are preferred to be given as heparin-free dialysis. So heparin increases bleeding risk. Therefore, heparin-free dialysis is used in patients who recently had surgery, trauma, or are active bleeding history. In such cases, saline flushes may be used instead of anticoagulation. Moving ahead to the sixth question, it says, why is it important to test for residual formalin in a dialyzer before reuse? So it is important to test for residual formalin in a dialyzer and tubing which has been reused. So that why is that so important? So option 1 is saying to prevent clotting in the dialyzer. Option second says to ensure correct blood flow rate. Option C says to avoid patients exposure to toxic levels of formaldehyde, and option D says to improve dialysis conductivity. I guess everybody knows what is the answer. So there is no direct role of formalin in clotting, so it is a no. Ensure correct blood flow, na, that's also false. And to improve dialysis conductivity, na. We do this because formalin is used to disinfect dialyzer in reuse system, but if it is not rinsed properly, residual formaldehyde can enter patient's bloodstream and can cause severe toxicity. Testing ensures patient safety. So they can cause anaphylactic reactions, back pain. So all this scenario we want to avoid. That's why we check for residual formalin levels in the dialyzer. Moving ahead to the seventh question, it says, which of the following is most common type of kidney stone? So kidney stone, there are different type of kidney stones. Some are oxalate, some are citrate. So we have to choose the one which is most common. So option 1 is struvite, option B is calcium oxalate, option C is cystine, and option D is uric acid. So the most common stone is actually calcium oxalate. This is very important question. So calcium oxalate stones are most common type of renal calculi worldwide. They form due to high calcium or oxalate concentration in urine and are associated with dehydration and metabolic disorder. Apart from the type of stones, they even sometimes ask about the structure of the stones. So make sure you also revise them. I have already posted a video about them on my YouTube channel. You can also check that, or even you can check that on my Instagram account. I have also uh, posted many infographics related to the kidney stones there, about their structure, about their size, and transluminance and opacity. So I think that will be very beneficial for you. Moving ahead to the eighth question, it says, which symptom is most common associated with peritonitis in peritoneal dialysis patients? So we have to find the symptoms which is commonly associated with peritonitis in PD patients. So option 1 is headache, option B is back pain, option C is chest pain, and option D is abdominal pain. So most common associated with peritonitis will be abdominal pain. Peritonitis in peritoneal dialysis typically present with abdominal pain, cloudy dialysate, and sometimes fever. Abdominal pain is often earliest and most prominent symptom. So whenever a patient complains about abdominal pain and he or she is on peritoneal dialysis, you should always think about peritonitis. moving ahead to the ninth question. It says, what is the basic functional unit of a nervous system? So option 1 is dendrite, option B is axon, option C is synapse, and option D is neuron. So the basic functional unit of a nervous system will be neuron. This is wrong here. Sorry. This one is wrong. The right answer is option D, neuron. A neuron is a fundamental functional unit that transmits electrical and chemical signal. Dendrites and axons are part of neurons. So the right answer is option D, neuron. Moving ahead to the 70th question. It says, which of the following is recognized genetic cause of tubulointerstitial nephritis with autosomal dominant inheritance? So option 1 is WT1 gene mutation. Option B is MUC1 gene mutation. Option C is Alport syndrome. Option D is Fabry. This is from pathology, and I have a dedicated video made on the pathology part relevant for dialysis. So I will suggest you to watch all the videos related to pathology on my YouTube channel. And moving to this question, the answer will be MUC1 gene. So what happens? Mutation in MUC1 gene cause autosomal dominant tubulointerstitial kidney disease. It leads to progressive kidney failure with interstitial fibrosis and tubular damage. So this was the last question of this part, the part 7. Hope you enjoyed. Make sure to like this video, and practice sheet will be available on the Telegram page. Make sure you practice all the questions there, and also share these videos with your friends who are also preparing for dialysis examination, because when we share, it will help our channel to grow. So thank you. Make sure to like this video. Have a nice day.